Hey guys, I'm Jimit, and on this channel I talk about health, wellness, and life. In this episode, I want to talk to you about prediabetes, diabetes, metabolic health, high blood sugar, and how you can use this information to be metabolically healthy. Let's begin. I'm witnessing an alarming trend. I see a lot of people who are struggling with weight loss, obesity, metabolic health. Some of them have prediabetes and some of them have full-blown diabetes. What baffles me is they do not take this particular disease seriously. They look at it as if something that happens to them and that you go to a doctor or you pop a pill and you go on with life. But I see prediabetes as a wake-up call. It's a sign that there's something wrong in your body that you need to address right away before it leads to bad health outcomes later in life. Knowledge is power, especially when it's applied properly. And hopefully in this video, I can give you some tips and tools where you can improve your metabolic health. What is prediabetes? Prediabetes is a serious chronic condition where your body is unable to regulate your blood sugar levels. Your blood sugar levels are elevated, but not elevated high enough to be classified as full-blown type 2 diabetes. Which brings us to the next question. What are the types of diabetes? Well, there's type 1 diabetes and there's type 2 diabetes. Type 1 diabetes is an autoimmune condition that affects a very small percentage of the population. However, type 2 diabetes is a very serious chronic condition that affects a vast number of people. And it should be taken very, very seriously. In this episode, we are going to primarily talk about type 2 diabetes, or simply diabetes. So what is diabetes? As I mentioned earlier, diabetes is a condition where your body cannot manage its blood sugar levels. Blood sugar is also known as blood glucose. Now, why is glucose important? Well, glucose is the fuel source for every single cell in your body. The cells in your body are powered by glucose. But for them to be powered, glucose needs to enter the cell. This is where insulin comes in. Insulin is a hormone produced by the pancreas, and insulin acts like a key that unlocks the locks on cells that allows the glucose in. Now, what happens in diabetes is that there's too much glucose in your bloodstream, and the cells in your body become resistant to the signals of insulin. What happens is that the doors on the cells that allow the glucose to enter don't open. And this is called insulin resistance. There is also another condition where your pancreas don't produce enough insulin to be able to unlock the doors of the cells. In both conditions, what happens is that there's too much glucose floating around in the bloodstream, and that is bad. Your body likes to maintain a certain level of glucose in the blood. It cannot be too high and it cannot be too low. Levels have to be maintained for optimal health. Now, the blood does not like too much glucose lingering in there for many reasons, but the main reasons are that when the glucose is inside the bloodstream, it is unable to enter the cells and power them, and therefore the cells start malfunctioning. Excess glucose in the bloodstream interacts with proteins and fats in a process called glycation, which then damages cells throughout the body, such as cells in your liver, kidneys, and even your heart. Chronic hyperglycemia, or high blood sugar, is the hallmark of diabetes. And most chronic health conditions are downstream from this. It begins when you're overweight, then progresses to obesity, to then prediabetes, and then diabetes. And from there, you have heart and kidney disease, you have cancer and stroke, you have dementia, you have autoimmune diseases, and nerves, cells, and veins across your body getting damaged and even Alzheimer's disease, which is now being categorized as type 3 diabetes. So, diabetes leads to overall worse health outcomes. So, who's at risk for prediabetes? Well, if you're overweight or obese, then you're at high risk. If you're living a primarily sedentary life, your risk goes up. If you have a parent or a sibling who has diabetes, again, your risk factors go up. If you are a woman and you have PCOD or PCOS, your risk factor increases. And generally, as you age, about the age of 40, 45 and 50, your risk factors go up. The problem with prediabetes and diabetes is that there are no outward symptoms of the disease. So it's very difficult to tell if you already have it or if you're at a risk for developing it, which is why it is very important to get yourself tested regularly. There are three main ways where you can get tested for prediabetes and diabetes. The first one is fasting blood sugar, the second is random blood sugar, and the third is HbA1c or hemoglobin A1c. Allow me to tell you a little bit more about these tests. Fasting blood sugar. This test measures your blood level after not eating for a certain amount of time, and the normal range is less than 99 milligrams per deciliter. Random blood sugar. This test measures your blood sugar level at any given point of time. This test is convenient but less precise than HbA1c, and the normal range is less than 140 milligrams per deciliter. And finally, the third test is hemoglobin A1c, which at present is like the gold standard for getting tested for prediabetes and diabetes. This test reflects your average blood sugar control over the past 2 or 3 months and is a key diagnostic tool for prediabetes. It's best if you're below 5.7%. A simple blood test can give you peace of mind if you don't have prediabetes or cause you to take action in your life to have a better health outcome for yourself. I urge you to get tested as soon as possible. Now, prediabetes as a condition is reversible with a few changes to your lifestyle, and most of these I have tried out in my own life. So allow me to show you what has worked for me, and it may work for you as well. Eat more fruits, vegetables, lentils, and legumes. Don't eat sugar, sugary beverages, highly processed foods, and refined grains. Get moving. Yoga, Pilates, lifting weights, working out, or even going for a simple walk really helps. And finally, stay hydrated, prioritize sleep, cut down on your alcohol intake, and quit smoking. If you feel that you are at risk for prediabetes, I urge you to get tested and seek a medical professional. According to the International Diabetes Federation, there are more than 500 million people around the world who suffer from diabetes. I hope the information in this video will help you and your loved ones live a healthy and happy life. Thank you.